In this video, I'm going to show you how Medicare handles hospice, and this video is broken up into 4 sections. How to qualify for hospice under Medicare, what hospice will cover, the costs of hospice coverage, and the interplay of other things like Advantage or supplement plans, as well as going on and off hospice. What should be a relatively straightforward topic actually has some nuance, so I'll try to cover most cases. There could be some fringe situations that I just can't get to. I will be saying you a lot, but I recognize that if you are watching this, it likely means that you are caring for a loved one. Hospice is covered under Medicare Part A, and to officially qualify for hospice care, you must meet all 3 of the following conditions. First, your hospice doctor and your regular doctor, if you have one, must certify that you are terminally ill, meaning a life expectancy of 6 months or less. The second qualifier is you need to accept comfort care, also called palliative care, instead of care to cure your illness. The third and final qualifier, you must sign a statement choosing hospice care instead of other Medicare-covered treatments for your terminal illness and related conditions. All 3 of those must be met to move to hospice coverage under Medicare. Once you move to hospice, you have a hospice care team who will work with you through this time of life. Now let's go over what hospice will cover as well as what it will not cover, and this is kind of a long list, so if you want, you can pause the video as we scroll through these. Depending on your terminal illness and related conditions, the plan of care your hospice team creates can include any or all of these services. Doctor services, nursing care, medical equipment like wheelchairs or walkers, medical supplies like bandages or catheters, prescription drugs, hospice aid and homemaker services, physical and occupational therapy, speech-language pathology services, social worker services, dietary counseling, grief and loss counseling for you and your family, short-term inpatient care for pain and symptom management, short-term respite care, and any other Medicare-covered services you need to manage your terminal illness and related conditions as recommended by that hospice team of yours. Original Medicare will still pay for covered benefits for any health problems that aren't part of your terminal illness and related conditions. However, you'll need to pay any deductible and coinsurance amounts for those Medicare-covered services that you get to treat health problems that are not part of your terminal illness. This is unusual. Once you choose hospice care, your hospice benefit will usually cover everything you need. There are a few things that the hospice benefit will not cover once you start it. It won't cover treatment meant to cure your terminal illness or related conditions. For example, if you have cancer and you go on hospice, chemotherapy is an attempt to cure, and it is not covered by hospice. Prescription drugs that are not for your terminal illness or related conditions. These drugs aren't included in the hospice benefit. However, they may be covered by your Medicare Part D drug plan, and you would have whatever deductible or copays related to that separate drug plan. Hospice does not cover care from any provider that wasn't set up by the hospice medical team. You must get hospice care from the hospice provider you choose. You can't get the same type of hospice care from a different hospice provider unless you change your hospice provider. However, you can still see your regular doctor, nurse practitioner, or physician assistant if you've chosen him or her to be the attending medical professional. Your hospice benefit doesn't cover room and board, sort of. This is where things get a little weird. Hospice care, meaning the actual services that you receive, and then the location where you receive that care are 2 very different things and billed in different ways. And depending on the level of hospice care, the facility at which you receive the care may or may not be covered. There are 4 levels of hospice care. The first and the level at which most experience hospice care is called routine home care. In this level, the patient is generally stable and the symptoms like pain or nausea and vomiting are controlled. As the name suggests, location-wise, this is usually provided in the home. Hospice does not cover the facility charge for this level of care. So if you or your loved one is in a nursing home, as an example, when receiving this, hospice does not pay anything towards any facility charge. The second level of care is called general inpatient care, or GIP. This is a crisis-like level of care for short-term management of out-of-control pain and symptoms. This is usually provided outside the home in an inpatient setting at a medical facility like a hospital or skilled nursing facility. It's less common than the routine home care, but this is what my mom experienced recently for those who have followed this channel for a bit. With this level of care, hospice does cover the facility charge. The third level of hospice care is continuous home care. This is also crisis-like level of care for short-term management of out-of-control pain or symptoms, but it is usually provided in the home. Given that it is in the home, that means hospice does not cover the facility charge because, well, it's your residence, whether that's your home, a family member's home, or a nursing home. Finally, the last level of hospice care is respite care. This is a level of temporary care provided in a nursing home, hospice inpatient facility, or hospital so that a family member or friend who's the patient's caregiver can take some time off. This level of care is tied to the caregiver's needs, not the patient's symptoms, so the facility charge really doesn't come into play here. Okay, let's move to what it will cost you. Remember, hospice is provided under Medicare Part A, which for 99% of all Medicare beneficiaries does not have any sort of monthly premium to pay. Even though you pay nothing for hospice care under Original Medicare, the care you get must be from a Medicare-approved hospice provider. You do pay a copay of up to $5 for each prescription for outpatient drugs that are for pain and symptom management. If hospice does not cover a drug that you need, which is rare, your hospice provider will reach out to your drug plan to see if Part D covers it. The hospice provider is required to inform you if this is the case and if you'll be required to pay for these medications. You may pay 5% of the Medicare-approved amount for inpatient respite care, what we've covered in those earlier 4 levels of care. For example, if Medicare approves $100 per day for inpatient respite care, you'll pay $5 per day and Medicare will pay the $95 per day. Your copay for this cannot exceed the Part A inpatient hospital deductible for the year. Okay, let's talk about what happens to your other plans once hospice care comes into play. I'm talking about your Advantage plan or your Supplement plan. Once you start getting hospice care, Original Medicare will cover everything you need related to your terminal illness, even if you choose to stay in a Medicare Advantage plan or a Medicare Supplement plan. If you were in a Medicare Advantage plan before starting hospice care, you can stay in that plan as long as you pay your plan's premiums, if you have any. If you choose to stay in your plan will still cover any extra services that are medically necessary, like dental and vision benefits, covered services for health problems that aren't related to your terminal illness. You have the option to get these services from Original Medicare only or your Medicare Advantage plan. If you get them from Original Medicare, you may have to pay a copay. If you get them from your plan, like getting them through a network provider if you're in an HMO, you're responsible for your Advantage plan's copay. If you paid a copay under Original Medicare, keep your receipts. Your Advantage plan must reimburse you for the extra amount that you paid. If your Medicare Advantage plan offers a Part D prescription drug benefit, you are covered by the plan for drugs not related to your terminal illness. If your plan doesn't cover services from out-of-network providers, Original Medicare will cover services that aren't related to your terminal illness. If you have a Medicare Supplement plan, also known as a Medigap policy, it will cover those hospice costs for drugs and respite care, which were those $5 copays or the 5% coinsurance once you meet your supplement plan deductible, if you have one. Your Medigap policy will also help cover healthcare costs for problems that aren't part of your terminal illness and related conditions. Now, this is not advice, just observations, and you'll want to work with your agent around this. Oftentimes, since so much is covered by Original Medicare Part A under hospice, if finances become an issue, many elect to drop their supplement plan so they are not paying the premiums for that plan. You do not have to do this. Similarly, for an Advantage plan, you can keep these plans once you go on hospice and start relying on Original Medicare only, but you do not have to. If your health improves or your illness goes into remission, you may no longer need hospice care, so people do go on hospice and then come off. You always have the right to stop hospice care at any time. If you choose to stop hospice care, the hospice provider will ask you to sign a form that includes the date your care will end. Stopping hospice care is a choice only you can make, and you shouldn't sign or date any forms until the actual date you want your hospice care to stop. If you were in Original Medicare when you decided to stop hospice care, you can continue in Original Medicare. If you're eligible, you can go back on hospice care at any time. If you were in a Medicare Advantage plan when you went on hospice care and you stayed with that Advantage plan, in the event you stop your hospice care, you're still a member of your plan and you can continue to get Medicare coverage from your plan after you stop hospice care. If you are on a supplement plan, similar story in that as long as you continue to pay your premium through hospice care and then you come off of hospice, you can continue in your supplement plan. If you stopped your Advantage plan or your supplement plan while on hospice care and then you decide to come off of hospice, this does not qualify as a special election period, so you would be subject to underwriting for the supplement plan in most states. There are exceptions, and then you would need to wait for an appropriate enrollment period to get back on the Advantage plan. Okay, let's answer the question of how long can you get hospice care. Hospice care is for people with a life expectancy of 6 months or less if the illness runs its normal course. If you live longer than 6 months, you can still get hospice care as long as the hospice medical director or other hospice doctor recertifies that you are terminally ill. Hospice care is given in benefit periods. You can get hospice care for 2 90-day benefit periods followed by an unlimited number of 60-day benefit periods. A benefit period starts the day that you begin to get hospice care and it ends when your 90-day or 60-day benefit period ends. At the start of the first 90-day benefit period, your hospice doctor and your regular doctor, if you have one, must certify that you're still terminally ill. At the start of each benefit period after the first 90-day benefit period, the hospital medical director or other hospice doctor must again recertify that you're terminally ill, so you can continue to get hospice care. Once your hospice benefit starts, you don't need to re-choose hospice care for each new benefit period. Again, if you or a loved one are experiencing hospice, please know that I know to a certain degree what you're going through, and our thoughts are with you. My email is in the description of this video. Here is the next video to watch, and I will see you over there.